There are 160 languages spoken in this school district and many, many nationalities and populations.
So we have a very high population of refugees, immigrants, and newcomers. We are the only formal network of community schools in the state of Colorado. So we have a whole plethora of programs being offered for our students that can range from dance classes to soccer clubs to academic intervention or tutoring. Our community schools are really viewed as hubs in the larger community. They're open after hours, and they're open for students, families, and any community member who would like to access services that are being provided. During COVID, we were able to develop partnerships to deliver vaccines. So with this grant, we were able to continue hosting vaccine clinics with our local health department and within our schools. We saw a great turnout at almost every one of our vaccine clinic events. So from the very beginning, we started hosting monthly meetings with our school nurses across all of our community schools to really make sure that we were collaborating effectively and efficiently, and then really bringing in those school nurses into our vaccine clinics.
It is extremely important that students are up to date with their immunizations, not only for their own health, but the community health as well. We had multiple languages spoken by the families, and our family liaison was able to get interpreters in person for each of the families. The family liaison is a critical role when it comes to helping the families because they get to know the families.
Outreach was our biggest goal, and getting families to those vaccine clinics was really, really important. We had educational workshops for vaccine hesitancy, and they were geared specifically for the community that they were targeting. Any way that we can generate that relationship with the family really goes a long way. We help families navigate resources like food insecurity, rental assistance, and electrical bill assistance.
We recognize that these positions are crucial in building trust with our families and in the larger community. We were able to use some of the grant funding to cover a gap in our current budget to cover the family liaisons for special populations positions. And then we also were able to print materials and flyers in multiple different languages. I think all of this work really allowed us to really bring our partnerships and our school staff together to really ensure that health equity was the ultimate outcome. We're promoting health equity in a lot of different ways. And so we have our dental clinics, we have school-based health centers, and we also have food clinics. The grant opportunity initially allowed us to start collaborating with our school nurses, and the work hasn't stopped. So we now have standing meetings with all of our nurses.
If we have mutual respect, then we are collaborating and we're moving forward to get the best for everybody. Let's look at this ear that doesn't work first. The school nurse today is part of the educational team in that we need to be able to be sure that a child is prepared to learn in that their health conditions are addressed.
I love being a school nurse. There is absolutely no other job like it.
My advice in partnering with school nurses within community schools is to do it, and to do it right now. We have such a better community school strategy because of our partnership with our school nurses.